this video, continuation of structural protein. Second one is elastin. What is elastin? It is presented in elastic tissue. It gives elasticity and recoil of lungs, blood vessels and tendons. It forms from coelastin. It's having simple structure, no glycine XY. Only hydroxylation occur in post-translational modification. What are the various disorders which are related to elastin? First one is Williams syndrome. This is a disease related with elastin. Defective gene for elastin. It results in the formation of supravalvular aortic stenosis. So first one is Williams syndrome. This disease related with elastin, defective gene of elastin. So result in the formation of supravalvular aortic stenosis. Second one is scleroderma. There is increases elastin. Third one is pulmonary emphysema. Fourth one is aging, decreases level of elastin found in the older age. These are the four conditions which are related in elastin. What are the four conditions? First one is Williams syndrome. Second one is scleroderma. Third one is pulmonary emphysema. Fourth one is aging factor. Next one is third structural protein, name is called as Fibrillin. It is presented in the periosteum and aorta. Defective gene for Fibrillin 1 leads to Marfan syndrome. This one is the inherited disorder affected heart, eyes, blood vessels. So third one is Fibrillin presented in the periosteum and aorta. Defective gene for Fibrillin 1 leads to Marfan syndrome. It is a Marfan syndrome is a inherited disorder affected heart, eyes, blood vessels. So these are the structural protein. Now coming to the specialized glycoprotein. Glycoprotein means carbohydrate plus protein. What are the specialized glycoprotein presented in extracellular matrix? First one is Fibronectin. Second one is Laminin. Fibronectin, it is a large glycoprotein. Fibronectin is a large glycoprotein and it is responsible for cell addition and migration. Fibronectin is a large glycoprotein and responsible for cell addition and migration. Laminin, it is presented in the lamina of basement membrane and it is responsible for glomerular filtration. This fibronectin is responsible for connection between cell and extracellular matrix. Okay, it is responsible for connection between cell and extracellular matrix. If there is deficiency of fibronectin which is found in tumor cell, in tumor cell there is decreases in fibronectin level, there is loss of cell addition and tumor cell will metastasis. The metastasis will occur due to the loss of cell addition and decreases in the fibronectin level. So there is deficiency of fibronectin level means there is a loss of cell addition and tumor cell metastasis will occur. Second one is laminin. It is responsible for glomerular filtration. Due to this thick glomerular membrane, it is responsible for charge selective glomerular permeability. It is particularly important in the case of albumin. Mainly, it is negatively charged heparin sulfate, due to which albumin in normal cases does not cross this filtration barrier, but whenever there is injury to this glomerular basement membrane, there is loss of this charge occur and this low molecular weight albumin will filter to this membrane. This is particularly important in glomerular nephritis and nephrotic syndrome. So laminin, these are the two specialized glycoprotein, fibronectin and laminin, presented in extracellular matrix. Next, proteoglycan. It is made up of core protein. This is the structure. It is principally made up of glucose amine glycan and the concentration is up to 95%. So various glucose amine glycan is there. It is maybe hyaluronic acid, keratin sulfate, chondroitin sulfate, dermatin sulfate, heparin sulfate and Hepherine. This hyaluronic acid, it is presented in synovial fluid. It is responsible for shock absorbent and lubricant. Second one is keratin sulfate. It is presented in cornea. It is responsible for corneal transparency. Third one is chondroitin sulfate. It is presented in cartilage. Fourth one is dermatin sulfate. It is presented in skin. Then heparin sulfate. It is presented in glomerular basement membrane. It is responsible for charge selective glomerular filtration. Charge selective glomerular filtration. Next one is heparin. It is a anticoagulant presented in lungs and liver. These are the various glucosamine glycan involved in the formation of proteoglycan. They formed ground substance. They act as a shock absorbent and lubricant and responsible for formation of various tissue to give shape to the tissue. Various proteoglycan are aggregate. Now various disorder related to proteoglycan and glucosamine glycan. Disorders related with proteoglycan. First one is mucopolysaccharidosis. What are the classical features of mucopolysaccharidosis? First one is skeletal deformities. Then coarse facial feature, that means large bulking head. Then hepatosplenomegaly. It affects a disorder of both liver and spleen. Then it causes Hurler syndrome, enlargement of, what is Hurler syndrome means enlargement of spleen and liver. Then Hunter syndrome, it is a inherited disorder, mixing of malfunctional enzymes, missing of some enzymes. After that, Zanflippo ABCD, it affects brain and spinal cord. These are the disorder related with proteoglycan. First one is mucopolysaccharidosis. What are the classical features? Means skeletal deformities, hoarse facial features, and hepatosplenomegaly. It mainly affected spleen, liver, central nervous system, and brain also. Then Hurler syndrome, Hunter syndrome, Sanfilippo ABCD. It affected brain and spinal cord. Thanks for watching.